Hello, hi everyone. My name is Wugiatu Tula. I am a student nurse and public health advocate that reside in Mott Haven and Melrose, also known as Stourbridge in New York, Bronx. During this presentation, I will be showing you demographic data and health outcome that's important to my community and how it relates to nursing advocacy and promoting public health awareness. So as you can see, this is the demographic data, who we are. So for who we are demographic, we look at who we are. It tells us that there are 96,584 people who live in this community, and 63% of people said their health was good, very good, excellence. So for the life expectancy, you can say is 78.4 years. So when it comes to the race and ethnicity, you can see here, my community Latino was the majority, where 74% of people identify as Latino and 24% identify as Black. Also, we can select here that 30% of people are born foreign outside of the United States, and 29% people living here speak English not very well or not at all. We must keep this in mind when communicating with our patients and keep their culture communication-wise. For the age side, you can see 27% are less than 18 years old, and 30% here is 65 years old. The level of measurements is telling about the nominal data. So that one will be like race, ethnicity, because they are just labeled. So for the ordinal data, the age, you can categorize that on age because there is an actual order to be labeled. For interval data, life expectancy, because does not start at true zero. For ratio data, so the population and percent, because you have mathematically measured it. So for ratio data, it can run into all the other forms if it was not provided in that form. So an example of ratio data can fit into any categories will be health, because can put it on an ordinary, which would be proper excellence. So I will take you now to the health outcome. So now I have shared the health outcome, as you can see, and there are high rates of chronic illness, which is 36%, and you can see that 35% here are high blood pressure, and the 16 are diabetes. So this chronic illness contributes to other health issues like heart disease and stroke, which is why the number should much lower. The percentage of adults with which disease are higher than New York City standard, which is not good because you are putting yourself at risk. You have like the personal health environment, and yes, so for personal, people who live in my community are being affected by many different cultures, language, and low income. So for the health, is being affected by preventable chronic illness. Why is the environment they live physically, and what type of support system they receive from the environments they live in. So for nursing, I can nurse those patients by educating them on their disease and how to prevent it while incorporating health lifestyle choices. I can also advocate for them to get the care they need that is affordable and understanding their background. As you can see, by knowing who live in my community and the type of health they have, we can pick up on certain health problem and see where we can better improve on them. I can use this data to better advocate for my patients in the future, prevent disease and overall health. Thank you. I can stop sharing my screen now.